Hi, welcome to Digital Dialogs, your compact conversations on the future of technology. My name is Renee from Reply, and today we're going to talk about treating ADHD with Focus Buddy, which is a really cool topic, also very near and dear to my heart. And for this, I also have a special expert guest today, Daniel Fitzpatrick. Hi, Dan, how are you today?
I'm excellent. Thanks for asking. Renee, it's great to be here. I appreciate the invitation.
Awesome. Let's talk about, or let's first introduce yourself to our audience, please, because they might not know you, although you're a super cool dude. But tell us a little bit about your background and the work you're doing.
Certainly. Academically, I started my career with language sciences a long, long time ago, and then spent many, many years as an interface developer. So, really enabling humans to interact with digital applications in the most natural manner possible. And a while ago, I developed a passion for voice interfaces because human beings have been using computers for about 80 years now, but we've been using our voices for 200,000 years. So I thought there might be some advantages in allowing humans to talk to digital applications. And that's what brings us to our subject today.
Awesome. And yeah, it's like you're saying. I mean, now is the time also with language models and all of that, right? And you can build on your knowledge from linguistics. What a word! Hard for me to pronounce linguistics. Talking about linguistics, but we're getting there. Anyhow, let's talk about Focus Buddy, which I hear it is a pretty cool tool or device enabled especially with AI to actually help with ADHD therapy in a quite unique way, I would say. So first of all, explain to us what is Focus Buddy, and then what inspired you with this approach and how it differentiates itself from traditional applications in healthcare.
Mhm. Well, patients who suffer from ADHD usually have a whole panoply of individual syndromes and problems. Just quantifying and defining everything is usually very, very difficult. Uh, it's largely a problem with concentration. It's a problem with the way the different areas of the brain communicate with one another. And it has many, many different symptoms. Classically, you say, okay, this person has a lot of energy, or they're unconcentrated. Often, however, they're also emotionally dysregulated because of the fact that, hey, I can't concentrate. I want to have something to do, or people are unhappy with me because of my behavior. So they tend to have a whole bunch of symptoms. And obviously, there are different ways of treating those symptoms, one of which is different kinds of therapy. And obviously, therapy is a very, very encapsulated treatment environment. You go and you visit and you talk for an hour. But what happens if I'm confused or emotionally dysregulated at 11 o'clock at night? So, our original approach was to say, okay, we can use different artificial intelligence technologies like emotion AI, language recognition, things of that nature to give people, patients, an outlet, especially children, to help them. And our original concept was for emotional regulation and concentration. So, what we did was we came up with a voice and gaming interface. And a child could say, "Hey, I had a really terrible time today at school and I'm furious," or I'm completely unsure, whatever. And then speaking to the voice interface within the device, it looks like a little astronaut or a toy. It might say something encouraging or, "Hey, I understand your feelings are valid. What can I help you to do to calm down?" And then we also incorporated a motion sensor into the device. So if the child says, "I'm just going to give you a good violent shake to help me get rid of a little bit of frustration energy," the toy would say, "Hey, go for it. Give me a shake." And then inside is built like a robot. So you open up the display and it's got all of the gears and levers inside that you might think a robot would have. Giving it a good shake just makes everything fall into disarray. And then we'd, hey, have to tell the child, "Can you put my gears back into place? Let's concentrate together for a minute." So that was the gaming aspect of it. And we developed a toy, and it works just fine. And then we took it into a clinical environment. We went to the child psychologists and psychiatrists. And the first iteration, we presented it to them, and they said, "Hey, good idea. Um, it's great that you can recognize human emotions, and it's great that you can provide a way of venting those emotions and then reinstituting a certain level of concentration. However, they said human therapy and human emotional recognition are still pretty advanced, and getting somebody into the point where they can receive therapy is probably a little bit more than a simple device can do. Great way to start, and we would certainly be able to take this into a small pilot study for clinical evaluation. But then they also brought us into, I'm going to say, a little discovery phase. They gave us a gold nugget to take back home with us. And that was sufferers from ADHD also have problems with so called transitions. They are either unconcentrated and unfocused, so they get into something called hyperfocus. I'm going to make an entire Lego castle right now, and I don't think I'll sleep through my classes. I won't go to bed tonight. I'm going to get this castle done because I'm in hyperfocus. But human beings have to lead regulated lives. You have music lessons this afternoon, and don't forget to pack your bag for school tomorrow. And toothbrush time is also very important for children. And all of these transitions are incredibly difficult for sufferers of ADHD for two reasons. They can't organizing themselves, and they suffer from low self-esteem due to failures in life. So they said, come up with some kind of a mechanism in your focus buddy to help clinicians, parents, and children act as a team. So we did that. We put in a motivational scheduler. So the focus buddy doesn't just offer emotional regulation, doesn't just offer a mechanism in gaming for concentration, but it also says, hey, don't forget you've got your music lesson this afternoon. You got to pack up your violin and your notes, and you're going to rock it today. You did a great job last week. And we use artificial intelligence for the motivation. So we go one step further and say, we have a simple appointment this afternoon. We know that we have a patient suffering from organizational issues, transitional issues, and low self-esteem. Let's give them a boost. So that's what we did with the Focus Buddy. And we took the version 1.0 with the emotional regulation, took it to the clinicians, and then we put the new features in, took it back to the psychological clinic and say, hey, what do you think of this? And the results were very positive.
Awesome. I'm glad to hear that you're actually working also with clinicians, with the true experts together. Because oftentimes, like you do it the right way, right? But sometimes you also see folks that just start with an idea, where they know the main experts, and then they think it will solve the problem, and it won't. And so, having the true domain expert part of the project from day one is, I think, also why it's so successful, right? And that's really cool to hear. And you already alluded to the fact how the focus body actually works, and how it addresses the challenges. In particular, I loved how you said, like, there's like some physical parts in it, and when you shake it, like they will kind of mingle together or something, and then you got to fix it. And you got to also use like so it's not purely digital in a sense, but there's also a kind of a physical aspect to it, which probably also helps with haptics and so on. So that's really cool aspect of that. What actually led you to choose ADHD as a focus for this project?
There are several reasons. First of all, there are many up and coming applications for artificial intelligence in the medical field. Maybe you know already, for instance, in dermatology, helping doctors diagnose skin conditions with spectrophotography and things of that nature. Artificial intelligence and machine learning mechanisms have an excellent success rate in identifying certain types of skin pathologies. Also, as a backup for a psychologist to do transcription and emotion AI during a therapy situation to bolster a psychologist diagnosis. Also, more mundane uses like medical transcription for patient files and things like that. IBM has a great artificial intelligence module for doing just that. It's been trained with medical terminology. So what doctors do is they dictate. So we're using transcription there to help out. We thought to ourselves, but is there some way that we could use this in actual diagnosis and not diagnosis, excuse me, but in therapy? And ADHD couples very, very nicely with the possibilities of emotion AI. Also, one of my roles within my job is to lead a worldwide think tank for voice machine interfaces. And one of the members has a child who is suffering from ADHD, and she knows very, very well what the different symptoms are and the difficulties are. So, from the one side, we had the patient's view, and we could put real life experience into our solution. And from the other side, we knew that we could put some kind of a theoretical solution up there, which might have little basis in reality. So we knew we needed the clinical backup. And that's how we completed the project.
Well, really, really nice, and also that you have like part of the COP that you're managing, also someone that actually has like a someone like a child that is affected by this, and so that's of course a good motivation first of all. But I think you're right. Like we see AI in lots of fields. You mentioned dermatology, like for detecting skin cancer, better than human experts, and also deployed now in production, and so much more scale there. And also other forms of new technology, like in spatial computing. When we think about virtual reality, right? We did some work there with the COP regarding the using VR for treating anxiety and a few other things. It's really impressive because you can do exposure therapy to things that might provide you anxiety. So let's say simulating spiders or things like this, or height and a few other things, and you can slowly get up to it. But like you're saying, and that's also great that you're doing it together with clinicians, you gotta have true experts, right? You gotta have like true experts in the field. You cannot just give someone a VR headset and here's the spider app and now like use it, and they might get out of that worse than they were before, right? If there's no true clinician together with them. Yeah. So let's talk about also. It's a kind of an embedded app. You already mentioned a little bit how it looks like from the physical standpoint, right? But why did you decide to actually develop this as a new embedded app for the focus body? Like there are so many solutions already on the market in terms of where you could customize it. So why did you start from the beginning?
Mhm. Well, we decided to make it like a toy because, like I said, many of the sufferers are children. So we wanted to have something which would be acceptable, and we wanted to, like I said, use the newer generative AI technologies, emotion AI, and put it all together. Um, and there are many different. I'm sure everybody knows. Most of us have some kind of a wellness app on our smartphone. It might just be the health check, it might be something to help you sleep, it might be a snoring tracker, something to help you concentrate, a screen time limiter, scheduling help, and all that stuff. So that was kind of a challenge for us. We didn't want to have people come up and say, "Oh, great, you came up with another one of thousands of apps." So what we did was we went one step further. We said we are going to use emotion AI and the new benefits of generative AI to do the motivational aspect. And this is something which the last clinician we spoke to as a child psychologist, she said, this is something new. This is not just a scheduler to help during transitions. This is a booster. This is something which puts everything into a positive context. People, and I've literally read hundreds of hours of literature about ADHD and the suffering involved. People who have ADHD are chronically late because they can't get out of their tunnels. They can't get to that next appointment. And if they think they're on time, they're not because they can't concentrate enough to think as well. It was awfully cold last night. Maybe I'm going to have to scrape the window on my car. They get downstairs. Oh, I don't have a window scraper. I don't have my car keys. I have to go back upstairs. I'm unconcentrated. I didn't pack because, and then they're late. So, what does that do to your self esteem? You have a scheduler that does three things. It gives you the time, date, and place where you need to be. Second of all, it helps you prepare ahead of time by saying, don't forget to pack your tennis racket if you're going to go to tennis practice. And the third thing it says is, you're going to do a great job today. Let's work on that self esteem. So maybe you show up on time, have a great tennis lesson, you didn't forget anything because the app put those components together. But there's an additional aspect here. You have an app on your phone, you have an app, you have a device. It's not just for you. So your doctor can track it, or he can put in his input. And maybe he says something like, great job with the tennis lesson. Your parents can track it. Don't forget, your clinician's appointment this week has changed. Let's move that in the tractor. So not just the patient interacts, programs, and schedules, but everybody in their support bubble, which is also revolutionary.
I think that's a great functionality. I wasn't aware of that, and that sounds actually, like you're saying, very useful because you can actually track the functionalities and the services you provide with Focus Buddy, and you can track how well they're used, and they can also provide some other feedback, like it's bidirectional in a sense. So that's a really cool one. Have you, I guess, like, what are the next steps? Like, I guess you're also using it and collecting some data and then working together with clinicians to get like the telemetry data and analyze it to improve it and so on. And yeah, talk a little bit about that maybe.
Mhm. Certainly. On a technical basis, we have the components we need. I'm really curious to see where the developments are going to go with large language models. We During the research phase, we checked out a lot of different emotion AI cloud services, local services, to find out what level of precision can we achieve with um, emotion recognition. And insofar as human beings are direct in their speech and their context, those tools do a pretty good job. They can recognize um, joy, they can recognize happiness, disappointment, frustration, fury, and things of that nature. Those, however, are very, very placative, emotional expressions. What if somebody's being ironic? What if somebody's being sarcastic? So the new large language models are very, very good at replicating human speech, but they are not good at interpretative behavior. This is something referring back to those 200,000 years of human vocal communication, which we've been doing for a long time, and computers can't do it yet. So there is often hidden contextual meaning in what people say. What we are doing now is developing new prompting ecosystems for emotion AI and large language models to help them read between the lines. So if somebody's sitting in a restaurant, the waiter comes up and the person says, everything on the menu looks so delicious. It's an indicative statement. Maybe it's a compliment, but what the person is really saying is, I can't decide what I want to eat. Help me make a decision. So large language models can't do that yet. We need to enable them to read between the lines of human communication. We need them to go one step further. Large language models are very, very good at providing binary answers, truth or false. But a person doesn't always need a binary answer. They need their conversational partner to think one step ahead. So, have you seen my Focus Buddy? You might say something like, yes, it's on the table. That's two answers in one. You're taking the conversation one step further, and this is something we need to teach them. So that's where the future is going, and I'm really excited to be doing something that's never been done before, not only in a medical field, but also in a socio-linguistic field as well.
What a great ending sentence here, actually, and I can just fully agree with that. It's an exciting time, and we can leverage this technology, like you were alluding to, right? Like for better sales, like hey, you wanna have this for your dish, or analyzing it. But we can also use it to improve people's life, which is just awesome. That's what oftentimes is forgotten about the benefits of AI, right? People sometimes have this perception, oh, this bad AI stuff, it's going to take our jobs, and all these other crazy stuff. No, it's going to help us improve our lives for everyone, and at a much higher scale. And so not like it's not a premium thing anymore, right? Then to get like certain good therapy and getting good healthcare. It's like, we see it already with the dermatology devices, right? There's like commercial devices that are deployed now that have full AI. They can detect skin cancer better than a human, and much higher scale, right? And so let's get this into all aspects of healthcare. And I'm excited for the work you're doing, and I want to keep up to date. So I'm sure we will get you back in one of the next episodes in the future,
We
to
will.
learn more about what Focus Buddy is doing these days.
One last little point. With a focus buddy or any kind of a psychological application is replicable. You can make many of them. One of the things we learned in the community of practice and with our young patient who's suffering from ADHD is to get an appointment in a clinic could take up to 8 months. So, what do you do if you have a device which might help immediately?
Yeah, that's the beauty of it. And thanks so much, Dan, for sharing about Focus Buddy and also the future ahead of it. I'm sure it's bright. It was really an enjoyable conversation, and thank you so much. Very much appreciated.
All on my side. Thank you very much. It was great to be here.
Well, and thanks everyone for joining us for yet another episode of Digital Dialogues, your compact conversations on the future of tech. Watch our blog, follow our social media channels, and of course, subscribe to our Reply podcast on your favorite podcast platform to not miss the next episodes. And of course, you can always go to our website, reply.com, to see all the previous episodes and also get the current ones, obviously, right? Until then, take care and see you soon. Bye bye.